President. I rise in opposition to the confirmation of Larry Johnson as the head of HHS. HHS is a behemoth of a department that impacts the lives of hundreds of thousands of Iowans every year, if not every day. Iowans who are young and old, Iowans who are hungry, Iowans who need health care, Iowans who are healthy, and Iowans who have a disability. HHS needs to be responsive. It is an enormous responsibility. They need to be responsive to individual Iowans. They also need to be responsive to this body and to LSA, because we as a body, as a chamber, should not be put in the position of having to decide and to vote on bills when we cannot get the fiscal information that we need to make those votes, when HHS does not provide the fiscal information necessary. And that has been a pattern both prior, last year, as well as this year. HHS is also now curbing and cutting services from some of the most vulnerable Iowans. The MCOs are changing interpretations and cutting services in half for disabled and vulnerable Iowans who desperately need those services. I cannot support someone who continues to allow this practice to happen when Iowans want to keep their loved ones at home in the least restrictive environment, which also happens to be the most fiscally responsible environment. Those two coincide. I cannot support this nomination.